Hi, my name is Mayana. I'm a student at the Kirkwood Community College Physical Therapist Assistant Program, and I'm going to be involved in your treatment if that's okay today. Awesome. So I've been told that you're having some pain with your neck, and I wanted to kind of see if you're a candidate for cervical traction today. Maybe that can help release some of that pain today. So if you're all right with that, we're going to move on and do some tests, just some light touching, and just ask you some questions to see how you're doing. So on a scale of 0 to 10, would you say that your pain is 0 being no pain at all and 10 being you need to go to the emergency room, just as you are sitting now? Okay, and then on a scale of 0 to 10, same pain rating scale, when you're doing an activity that causes a flare-up in that cervical area, where would you put your pain? All right, so if it is okay with you, I'm going to do some light touching and just kind of feel around in that cervical area to see if we can move forward in the treatment today. So I would do some light touching, blanch testing, and then would just check the muscle tone for any stringy type muscles. And then after that, I'm going to ask the patient if they are okay going down into a supine position so I can perform some cervical traction for about a minute and to see if it's okay to move forward from there. So I'll have them lay down, put my hands on the side of their neck, do the palpations, do some light pulling and see how their range of motion is. And then from there, I'm going to go back and talk to the patient again and say, so it looks like we can move forward with some cervical traction here today. The traction will allow some space to be made present between the vertebrae and the nerves. Currently, the vertebrae and the nerves are being crushed, so with the traction today, it's just going to allow some space to be made to provide some healing and just reduce some of that pressure in that pain. You're going to feel a bit of a pulling sensation. It should be strong but tolerable. Please let me know if your symptoms worsen or lessen during the treatment. So if we're not already in a treatment room, I'm going to go back from the gym to the treatment room. I'm going to clean the cervical traction unit with an alcohol wipe and prepare it for the patient, adjust it to the middle level, that's where it should be on average, and then I will have the patient lay supine, put their head into the traction unit, strap the head in with that strap, and then if the patient wants, I'll put that barrier towel or rag, whatever works for them if they're comfortable with that. I'm going to ask if they're comfortable in the position to stay there for the 15-minute time frame. I'm going to pump it to level 10 by twisting it to the right. Then I'm going to turn it on to the hold setting. From there, I'm going to ask the patient how they feel, if they're comfortable, if there's anything I can do to make them more comfortable. And then I'm going to stay with the patient for 5 minutes just to monitor if there's any severe changes or an increase in pain or if they just have any more questions for me. I'm going to check in with the patient. Does that feel okay for you? I'm going to leave just for about 10 minutes. I'm going to set a timer for that. I will explain to them that to release the cervical traction unit, you're just going to twist it to the left. That's going to release the pressure, and then you can remove the strap if they're feeling any kind of intense pain. And then I'm going to leave a bell with them before I leave the room. So if anything comes around that's too severe or they can't handle it, they need to get me immediately, they can ring the bell. So I've got them all strapped in. I've explained all of that to them. Go ahead and leave. Go talk to the PT, whatever I need to do. Timer goes off and my 10 minutes are up. So I'm going to come back into the treatment room. Say, hi, how did it go? Did you notice any changes in your pain? And while I'm asking them these questions and how they're feeling, I'm going to be removing the strap from their head, helping them up slowly. Beforehand, I'm going to release the pressure first. So release the pressure, release the strap, help them up, let them adjust to sitting again. And then I'm going to just look around at the skin, do some light palpitations, seeing if any of the muscle tension has changed. And then I'm going to go ahead and ask about the pain scale. So on a scale of 0 to 10, like we talked about earlier, 0 being no pain and 10 being you need to go to the ER, how would you say that cervical pain is feeling now, just at rest? Then they're going to answer, and I'll say, okay, great. And I'm going to walk them out to the front desk and see if they need to get scheduled, and then ask them if they have any questions or concerns for me that I can help them with. And then from there, I'm going to go back into the treatment room and clean up that area, that cervical traction unit, and then get ready for my next patient.